oftentimes our frontline healthcare workers are so busy worrying about the needs of others, they forget to address their own mental health and their well-being. That's why Bernalillo County is working hard to ensure that all frontline behavioral health employees are safe and taking care of their own mental health first and foremost. I spoke with Department Director Margarita Chavez Sanchez to find out more details about the resources that Bernalillo County is providing. Joining us this morning, we have Margarita Chavez Sanchez. She's with the Department of Behavioral Health Services. Good morning.
Good morning. How are you?
I'm doing well. Thank you so much for asking. Margarita, this is a super important conversation that we're having this morning because we're talking about frontline workers and their mental health, which we all know right now they are at the forefront of this pandemic. So let's talk about that. Right now that frontline healthcare workers are dealing with so much, how is your department helping them cope with all of this?
Absolutely an important topic, right? We have been working for the past 11 months on helping others, connecting clients to services, and really working to care for others in need at this time. So what we're really seeing in this space is provider burnout. And so it's really important for us at the Department of Behavioral Health Services to make sure that we let frontline healthcare workers and any essential worker who's been working at this for all of this time, that they can access the resources too. When they're referring their clients to services and supports, they can access that referral as well. So at the Department of Behavioral Health Services, we're funding over 40 different providers along the continuum of behavioral health care, and we also promote the New Mexico Crisis and Access Line. So we want to make sure all the frontline healthcare workers know that those services are available to them.
Okay, so many different resources, especially, sometimes you just need that person to talk to and confide in about how you're feeling. And, we've heard it. We've heard it from frontline workers that they're dealing with a lot of depression. They're dealing with a lot of anxiety. So much going on at this time. So let's dive a little deeper into how do we make sure not only their mental health is okay, but how are you guys keeping your employees safe?
Well, at the Department of Behavioral Health Services, it's all encompassing. So we distribute N95 masks weekly to our staff. We've had a couple incidents where we've had clients come to access services with us, and then they've tested COVID positive later on. And so in order to add those extra precautions for our staff, we're distributing N95 masks to them. We've installed plexiglass partitions. We've implemented markings on the floor, like you see even at the grocery store, for social distancing, and really checking in with our staff. The big thing that we've also added that's really important is at the beginning of every shift, our clinicians are also adding a component of mindfulness. So 5 minutes at the beginning or the end of every shift to just stop and go through a mindfulness exercise where the staff can debrief, have an opportunity to just relax and be in that moment to have that self-help, self-care opportunity. We're also working on establishing a vicarious trauma training for all of our clients and all of our staff. And so while we know that the clients themselves have experienced loss across that continuum, right? Loss of loved ones, loss of job, loss of opportunity, but also our staff, right? They're seeing that loss in their life as well, and all frontline healthcare workers. I was recently having a conversation with the Cabinet Secretary of Aging and Long-Term Services, and she's navigating ways to get resources to nursing home staff who have had and experienced significant loss in the work that they're doing. And so we, again, in the management space of this work, need to make sure that we're doing everything we can to bring those resources to our staff.
I think you really hit the nail on the head saying there's so many people out that are dealing with some type of loss in one way or another. With all of the safety measures that you guys have now implemented for your employees, is this allowing for those behavioral health resources to kind of be one-on-one with the person in need of these services?
Absolutely. Here at the Care Campus, at the Bernalillo County Care Campus, we provide in-person resources to our clients. Many of our providers have had to shift to telehealth based options, but that doesn't work for every client. It's not a one-size-fits-all response. And so we have, again, put all of these measures in place to make sure that our staff are safe, they can continue to do the work that they do, and that our clients that are coming to us to access those services also feel safe, right? We want to make sure that safety is available for everyone who who is in the building and who is providing or receiving that care. Again, those partitions and the distancing and the masks. We also provide N95 masks for our clients when we need to transport them and we're in an enclosed setting like in a vehicle. So again, all of these little safety precautions that we've learned along the way, right? In March, we didn't really know what to do and how to put those precautions in place. We've learned a lot since then. Again, really thinking about vaccinations as they're rolling out in the future. We want to make sure that in the future, when we have the opportunity, that we can be assistance in providing those vaccines for our clients. Because again, sometimes their only resource they have is us. And so we want to make sure that we are doing everything we can to connect our staff and our clients to those resources. And again, have not a one-size-fits-all model, but something that meets our clients where they are to help them in this time.
Absolutely. Margarita, we're down to about 20 seconds real fast. And I want to give you this opportunity to talk specifically to our healthcare workers. Why is their mental health so important?
Well, again, the number one thing is I cannot care for someone else if I'm not okay. So you need to always make sure that your own health and your own safety is of utmost priority. In EMS, we think about making sure the scene is safe. You always need to make sure that you are safe individually so that you can provide the best care. So always think about your mental health. Make it equal with your physical health.
Real fast, give me your website.
Sure, burnco.gov/DBHS.
Perfect. Margarita, thank you so much for joining us this morning.
Thank you for having us. Appreciate it.